Occupational therapy is a dynamic field dedicated to enhancing quality of life and independence across all stages of life. This presentation will explore the foundational concepts and innovative practices that make occupational therapy a vital profession. Occupational therapy is a holistic health profession that empowers individuals of all ages to engage in meaningful activities. In this chapter, we will delve into the core principles and scope of occupational therapy practice. Occupational therapy is about helping people do the things they need and want through daily activities. It takes a holistic view, addressing physical, cognitive, and psychosocial challenges, and emphasizes client-centered approaches. The core goals of occupational therapy include achieving occupational balance, fostering functional independence, and promoting meaningful participation in activities that matter to individuals. Occupational therapy serves diverse populations, including children, adults, and the elderly, addressing a wide range of conditions and promoting independence in various settings. Occupational therapists work in diverse settings, such as hospitals, schools, cells, community centers, and homes, adapting their approaches to meet the unique needs of each environment. Key roles of occupational therapists include assessment, intervention planning, environmental adaptation, and multidisciplinary collaboration to support client needs. The occupational therapy process is structured, beginning with model selection and assessment, followed by treatment planning and evaluation to ensure effective outcomes. Selecting an appropriate model of practice is crucial as it guides assessment and intervention, tailored to the client's needs and the therapist's expertise. Assessment involves a comprehensive evaluation of the client's abilities and challenges, using a client-centered and holistic approach to identify priorities for intervention. Various tools and techniques are used in assessment, including standardized assessments, observational methods, and interview techniques to gather comprehensive data. Treatment planning involves setting SMART goals, selecting activities, adapting environments, and implementing interventions to ensure successful client engagement and progress. Evaluation and review are ongoing processes, involving regular monitoring, comprehensive evaluations, and adjustments to ensure goals are met and client satisfaction is achieved. The OT process flow is cyclical, involving model selection, assessment, planning, implementation, and evaluation, with ongoing adaptation to meet client needs. Occupational therapists use a variety of therapeutic techniques and activities to address client needs, ensuring interventions are meaningful and engaging. Purposeful activities in occupational therapy are designed to engage clients' interests while achieving therapeutic goals, such as through creative arts, gardening, cooking, and social skills training. Sensory integration approaches help clients process sensory information effectively, using activities like swinging, jumping, and tactile stimulation to improve sensory processing. Cognitive and psychosocial interventions in OT include expressive approaches, social skills training, cognitive rehabilitation, and coping skills development to enhance mental well-being. Adaptive equipment and environmental modifications are crucial in OT, providing tools and adjustments to support daily living and enhance independence. A case study of Sarah's kitchen independence illustrates how adaptive equipment can significantly improve quality of life, showcasing the practical impact of occupational therapy interventions. Occupational therapy plays a crucial role in mental health recovery by addressing the functional impacts of psychiatric conditions and building skills for meaningful community participation. It focuses on conditions like depression, schizophrenia, anxiety, and substance abuse. For individuals with depression, occupational therapy focuses on breaking the cycle of inactivity and withdrawal. By providing structured, meaningful activities with positive reinforcement, therapists help patients gradually re-engage in previously enjoyed activities, conserve energy, and establish healthy routines. In treating schizophrenia, occupational therapy employs sensory modulation to manage overwhelming experiences, cognitive training to enhance daily functioning, life skills training for self-care, and projective methods for creative expression and emotional processing. Occupational therapists assist clients with anxiety by breaking tasks into manageable steps, creating predictable routines, and teaching grounding techniques. Therapeutic activities include simple tasks, mindfulness exercises, and structured time management to reduce anxiety. In substance abuse rehabilitation, occupational therapy focuses on identity reconstruction, routine development, leisure exploration, and community integration. These activities help clients rediscover interests, establish healthy habits, and build skills for successful community participation. Group interventions in mental health settings offer peer support, real-time feedback, and opportunities to practice interpersonal skills. Creative arts, life skills, social skills training, and wellness recovery groups are particularly effective in fostering self-expression and coping strategies. Occupational therapy is essential in physical rehabilitation, aiding recovery from injuries and surgeries. It focuses on injury recovery, ergonomics, orthotic devices, and case studies to improve functional mobility and independence in daily activities. Injury and stroke recovery through occupational therapy involves motor retraining, ADL training, energy conservation, and cognitive rehabilitation. These strategies help redevelop strength, coordination, and cognitive function for better daily living. Occupational therapists design and fabricate custom orthotics to prevent contractures, support weak joints, and promote alignment. They collaborate with designers to create solutions that balance therapeutic needs with comfort and aesthetics. Preventative ergonomics and return-to-work programs are key in occupational therapy. By assessing workplace environments and implementing job demands analysis, therapists help prevent injuries and support safe return to work for injured workers. In a case study, Robert, a stroke survivor, regained independence through a 12-week OT program. Adaptive strategies and home modifications enabled him to perform self-care tasks and resume cooking with minimal assistance, highlighting OT's impact on recovery. Home adaptations for accessibility involve modifications like pull-down shelving, widened doorways, and roll-in showers. These changes, guided by occupational therapists, enhance safety and accessibility for individuals with mobility challenges. Pediatric occupational therapy helps children develop skills needed to thrive in daily environments. It focuses on developmental disabilities, early intervention, autism spectrum, and case examples to support growth in home, school, and community settings. Supporting children with disabilities involves school participation and developmental skill areas. Pediatric OT integrates therapy into natural contexts, making interventions meaningful and relevant to the child's everyday life. Early intervention programs in pediatric OT include neonatal care, developmental monitoring, parent coaching, and transition support. These programs ensure optimal development and successful integration into preschool and community settings. For children with autism spectrum disorder, occupational therapy addresses sensory processing, social engagement, and technology-assisted interventions. These approaches help improve communication, interaction, and learning. In a case example, Jamie, a child with autism, improved classroom engagement through sensory assessments and adaptations. After 12 weeks, his participation increased significantly, demonstrating the effectiveness of OT intervention. Sensory play in pediatric OT involves tactile exploration, vestibular activities, and proprioceptive input. These activities help children develop coordination, attention, and body awareness through engaging play experiences. Occupational therapy continues to evolve with new research and innovations, expanding the scope and effectiveness of interventions. It focuses on areas like long COVID rehabilitation, telehealth services, interdisciplinary research, and technological advances, occupational therapists are at the forefront of addressing long COVID's functional impacts. Innovative approaches include energy conservation, cognitive rehabilitation, and virtual support groups to help individuals manage symptoms and regain function. In the realm of occupational therapy, virtual and telehealth services are revolutionizing access and care. Remote assessment innovations allow for functional evaluations via video consultation, expanding access to underserved populations. Digital therapeutic tools, such as mobile apps and web-based platforms, provide structured therapy programs with remote monitoring and feedback from therapists. Virtual home visits offer guided environmental assessments, helping clients adapt their living spaces. Hybrid service models combine in-person and virtual sessions to optimize accessibility while maintaining quality of care and therapeutic relationships. Occupational therapy thrives on interdisciplinary collaborations, enhancing innovation and research. Partnerships with industrial design lead to the development of innovative assistive devices, such as 3D printed utensils and modular adaptive clothing. International research collaborations advance evidence-based practice through cross-cultural assessments and comparative effectiveness research, ultimately standardizing outcome measures. Technology is a game-changer in occupational therapy, offering new ways to assist clients. Robotic assistance and neurotechnology provide intensive practice and muscle activation for recovery. Virtual reality creates immersive environments for practicing real-life skills safely. Smart home technology empowers clients with voice-activated systems and integrated environmental controls, enhancing independence. Virtual reality is making strides in autism employment preparation. A groundbreaking study at King's College London highlights the effectiveness of VR in job interview training for young adults with autism spectrum disorder. The VR program offers customizable scenarios, real-time feedback, and exposure to challenging situations, significantly improving performance scores and reducing anxiety levels. Occupational therapy offers diverse and rewarding career opportunities with multiple pathways for specialization and advancement, from education requirements to career settings, salary outlook, and specializations. The field is rich with possibilities for professional growth. Becoming an occupational therapist in the UK involves a structured educational pathway, including undergraduate or pre-registration master's programs, supervised clinical practice, and registration with the HCPC. Key skills include strong communication, problem-solving, empathy, and physical stamina, essential for a successful career in OT. Occupational therapists can work in various roles and settings, from clinical practitioners providing direct care to service managers leading departments. Consultants offer expert advice, researchers develop evidence-based practices, educators train future OTs, and entrepreneurs create innovative service models. The salary and job outlook for occupational therapists in the UK is promising, with entry-level positions starting at NHS Band 5 and opportunities for advancement to specialist roles. The demand for OTs is projected to grow significantly faster than the average for all occupations, highlighting the profession's bright future. Continuing education and specialization are vital in occupational therapy, allowing practitioners to advance their skills in areas like mental health, pediatrics, assistive technology, gerontology, hand therapy, and neurorehabilitation. These specializations enable OTs to provide targeted interventions and improve client outcomes. Occupational therapists have numerous professional development opportunities, including advanced certifications and memberships in professional organizations. These avenues support research, education, and leadership, helping OTs stay at the forefront of the profession and contribute to its advancement. The transformative power of occupational therapy is best understood through real-life impact stories. These narratives showcase how OT improves lives and enables meaningful participation, illustrating the diverse ways practitioners and clients achieve success together. Joe's story highlights the impact of occupational therapy in supporting adults with learning disabilities. Through community integration programs, employment preparation, and adaptive cooking groups, Joe helps clients develop independence and social connections, achieving significant milestones in their lives. Barry's work as a driving adaptation specialist showcases the role of OT in enabling driving independence. By providing adaptive solutions like hand controls and voice-activated systems, Barry helps clients regain their freedom and confidence, emphasizing the emotional impact of reclaiming autonomy. Dence's leadership in a teaching hospital demonstrates the multifaceted role of OT in service development, research integration, and quality improvement. Her vision for the future includes expanding OT's role in preventative care and public health initiatives, highlighting the profession's evolving impact. Margaret's testimonial reveals the profound impact of occupational therapy in regaining confidence after a stroke. Through key interventions like kitchen task adaptations and community mobility training, Margaret's journey illustrates the transformative power of OT in rebuilding skills and independence. Adaptive solutions in occupational therapy empower individuals to overcome challenges and regain independence. Stories from Michael, Asha, and Liam demonstrate how customized adaptations in the workplace, clothing, and sensory environments can transform lives, highlighting OT's creative and impactful approach. As healthcare evolves, occupational therapy continues to adapt and expand its scope. Understanding emerging trends, technological integration, healthcare shifts, and the vision for 2030 helps practitioners prepare for future developments, ensuring OT remains a vital and innovative field. Several trends are shaping the future of occupational therapy, including technological integration, community-based practice, hybrid service models, and an evidence-based focus. These trends enhance intervention capabilities, improve access, and demonstrate value in healthcare systems, positioning OT for continued growth. The vision for occupational therapy in 2030 includes universal access, mental health prominence, chronic disease management, technology-enhanced practice, and global collaboration. These goals aim to address societal needs and ensure OT's role in promoting health and well-being worldwide.